Hello and welcome to our program. My name is Jessica Barch and I'm the Community Program Manager of the Greater Illinois Chapter. For those of you who are new to the Foundation programs, we welcome you. For those of you who are joining us again, welcome back. We're so happy to have all of you here today. Before we get started, I wanted to share some information. The Parkinson's Foundation has wonderful free resources. We have educational books, a podcast called Substantial Matters, a hospitalization kit, which is known as our Aware and Care Kit, a helpline staffed by experts, our website parkinson.org, and more. Today, I'd like to highlight one of our publications related to this program called Fitness Counts. This book highlights the importance and benefits of exercise as it relates to PD. In addition, we will send a follow-up email to the registrants of today's program about a week from now. This email will include a recording of this program, slides from the program, as well as information about the resources discussed today. I also wanted to share some exciting information about our national initiative, PD Generation. Did you know the Foundation is offering genetic testing at no cost for people with Parkinson's disease? Participation can be either in person at one of our participating Centers of Excellence sites or now from your own home through a telemedicine appointment and an at-home cheek swab collection kit. To learn more, visit parkinson.org/PDGeneration. Lastly, I wanted to inform you of our wonderful virtual series, PD Health at Home. This initiative was started during the pandemic as a way to keep the PD community engaged. This weekly series focuses on Monday, Wednesday, and Friday and highlights mindfulness, wellness, and fitness. To learn more or to register, please visit parkinson.org/PD Health. And now it is my pleasure to introduce our first presenter today, Dr. Danny Bega. Danny Bega is a fellowship-trained, board-certified movement disorders neurologist and associate professor of neurology at the Northwestern University Feinberg School of Medicine. He has completed medical school at Rush University and clinical training in neurology at Harvard's Massachusetts General Hospital, as well as Brigham and Women's Hospital. Dr. Bega has expertise in the care and management of patients with a variety of movement disorders, including Parkinson's disease. He has completed master's level training in clinical investigations through the Northwestern Graduate School and is the principal investigator for several industry-sponsored clinical trials. His primary area of interest is the study of alternative and non-pharmacologic interventions in movement disorders and their impact on quality of life. And he has received several grants to carry out his research. Thank you so much for joining us today, Dr. Bega.
Hi, everyone, and thank you for the introduction. It's a pleasure to be here. This is actually one of my favorite topics to talk about. I get to do talks talking about different medication options and other things, research that we have going on in Parkinson's disease. But exercise is something I'm passionate about discussing because in my interaction with my patients, the ones who I feel do the best are the ones who have an active role in their care. And I think when we talk about exercise, a lot of what we're talking about is empowering yourself as the patient with Parkinson's disease to be an active participant in your care. And while there is a lot that we can do to improve symptoms with medications, those patients who not just passively take medications, but also actively participate in their wellness and in their healthy lifestyle seem to do the best. I have some disclosures here. None of these disclosures are relevant to today's talk. So what I'm going to talk about first is just setting the stage for Parkinson's disease as more than a movement disorder. And while certainly we focus a lot on the movements in Parkinson's disease, the benefits of exercise and the importance of exercise are in really understanding Parkinson's beyond simply the movements. I'll talk about the role of exercise in Parkinson's disease and evidence behind exercise, as this is not just something that we're recommending due to a lack of better options. This is something where there's actually evidence. And if you really look at the literature in exercise in Parkinson's disease, it's overwhelming. There's so much evidence for exercise as a beneficial in Parkinson's disease. that I actually just selected a few highlights to things that I think are manageable to remember and keep in mind, but really I could talk for hours about the evidence for exercise in Parkinson's disease. And then I'll leave you with my exercise prescription, knowing that Parkinson's is a very individual disease and everybody has different needs. I'm going to give you sort of a general prescription for exercise for Parkinson's. So again, to set the stage, Parkinson's disease is certainly a motor disorder, a movement disorder, characterized by tremor, slowness, stiffness, difficulty with balance and gait. And we kind of have this vision in our mind of someone with Parkinson's disease, sort of in this cartoon on the left. But that's what we refer to as Parkinsonism, and it's important and it's apparent, but it's one piece of the puzzle of Parkinson's disease. And you can see it's actually a small piece of the puzzle if you think about all the possible things that someone with Parkinson's disease may be experiencing. And we're quite good at addressing the Parkinsonism part. We have medications that can help us manage the Parkinsonism. We have less medications for some of the other issues. Things like dementia. I know a lot of my patients are concerned about anxiety, sleep problems, and not everybody with Parkinson's is expected to experience this full constellation of problems, but it's a puzzle that has many pieces to it. And one of the things we need to do, and we spend our time with day to day when we're seeing patients, is kind of going through all of these different aspects of day-to-day life and trying to address as many of these as possible, or figuring out which of them are the most bothersome and trying to address them. But the unique thing about exercise is that it can really target many of these things simultaneously. Exercise is definitely important for motor symptoms in Parkinson's, but it can also target many of these non-motor issues, including cognitive benefits and sleep benefits. And so when we try and think about managing symptoms, certainly you can use a medication for one symptom and another medication for another symptom and another medication for another symptom. And many times we do need to use different medications for patients. Exercise can also be a holistic approach to managing many of these things together, along with the medications that we use. As we understand Parkinson's disease as a neurodegenerative disease, we know that the primary problem in Parkinson's is deep in the brain. It's shown in red here on a slice of the brain, deep inside in what's known as the midbrain. If you look at it on an autopsy, actually on the bottom with this ruler, you can see on the left is of someone who has had Parkinson's and passed away. On the right was a normal brain. And what you see on the right brain is this black pigment, this sort of stripe of black. That's where the dopamine is produced and released in a normal brain. You can see on the left one, it doesn't have that black pigment, and that's showing the loss of dopamine producing cells. We know that that's a fact in Parkinson's disease. So if you think about the neurons in our brains, the neurons are releasing dopamine, and dopamine is a chemical that facilitates normal movement. In someone with Parkinson's disease, you don't have as much dopamine being produced and released. And so that's shown there as the neuron is not releasing as many of those green circles. It's not releasing as many of those dopamine molecules. And that leads to impairment in movement. So what do? We replenish dopamine. That's the main way we try and manage movement problems in Parkinson's. And most people with Parkinson's are on dopamine replacement, most commonly levodopa. We can see, if we look at it under a microscope, we see this on the bottom right, this pink blob. That is the protein called alpha-synuclein, which builds up in these neurons and makes them not work and makes them stop producing the dopamine properly. So this is all something we've known for a long time. And we know that this progresses over time, leads to less dopamine production and more movement problems. So we're good at replenishing dopamine, but what we actually know is that this is a problem that goes beyond the dopamine center, that these abnormalities can be found in other areas of the brain, and other chemicals beyond dopamine can also be affected. And that leads to some of the other movement problems and some of the other non-motor problems, like mood problems and cognitive problems. But dopamine is an important chemical. So when we think about treatment options, I've listed pharmacological options on the left as just a basic scheme. A lot of these on the left, levodopa and some of these others, are focused on that kind of dopamine replacement problem. And that's really important in Parkinson's. But you can also see non-pharmacological therapies and surgical therapies, which also have an important role in Parkinson's disease. I'm going to focus just on exercise here, which is in the middle of this table. But all of these therapies together, all of them, are not cures for Parkinson's disease. All of them are there as the goal to improve symptoms and to improve quality of life. I hope that one day I'll be talking to you about ways that we can cure the disease and stop the disease. But all of these treatments that we have are right now improving day-to-day life. But it's not an insignificant thing. I think we do a really good job with some of our medications and importantly with exercise of improving day-to-day life and improving day-to-day symptoms. And while this is a progressive condition and we can't stop it with these interventions, we can slow down progression of disability when we can improve day-to-day life with a lot of these combination of these interventions. So let's talk about how exercise can do that. First of all, does exercise really matter and do we have proof for that? This was an important study. They followed people, over 100,000 people for more than 15 years to see who developed Parkinson's disease over that time. So you have a lot of people just being followed year after year after year, and then looking at who got Parkinson's disease. Those with more physical activity at baseline, and this was statistically true for men, was associated with lower risk of getting Parkinson's disease. So those with the most physical activity had a 30% less risk of eventually going on to develop Parkinson's disease. Here is another important graph. Here on the left, we have men, on the right, we have women. What you're seeing here is going across, you see years from Parkinson's diagnosis, and you see amount of physical activity along the vertical axis. And what you're seeing, the dotted line at the top is where the average exercise is for someone of the same age. And you can see in Parkinson's disease, it wouldn't surprise anybody to see that if you look at like 8 years from diagnosis, a person with Parkinson's disease is exercising much less than the dotted line, which is the same age person without Parkinson's disease. And you could say, well, that's because they have Parkinson's, which is limiting their exercise maybe. And that's not good, but maybe it makes sense to us. But what's interesting to me is if you go years before the diagnosis, if you go even minus 8 years before the Parkinson's symptoms even start, you can see that the person who's gonna eventually have Parkinson's disease is below the dotted line, is exercising less than the person of the same age. This was true for men and for women. And so what we're seeing here is that people with Parkinson's exercise less even before they have Parkinson's disease. And then that trend continues after the diagnosis. So there's some relationship between exercise being positive for having less Parkinson's. We did a study here at Northwestern using data from the Parkinson Foundation, looking at over 2,000 people with Parkinson's disease, and we split them into 3 groups. Those who didn't exercise at all, those who were low exercisers, and those who were regular exercisers. What we use 150 minutes a week as our benchmark for regular exercise, because that's what the American Heart Association has as their guideline for recommended amount of exercise in anybody for heart health. So we looked at 150 minutes a week. So at 1 year, those who were regular exercisers, 150 minutes a week or more, had a better quality of life, better mobility, less disease progression, and less caregiver burden, and less cognitive decline. So you can see the benefits are, so the exercise is being associated with not just better mobility, not just motor function, but the caregiver burden is less. So there's less of a reliance on care partners, and cognition. So not just motor symptoms. So why would this be? Why should exercise have any effect? Well, there's a lot of theories. I can't prove for you any of these, but there's a lot of theories, and there is some data on a lot of these theories. One is the idea of neuroplasticity, that even in a degenerative disease where we're losing neurons, the brain still retains plasticity. It retains the ability to form new connections and to grow new pathways even into old age, even with a degenerative disease. And so maybe by exercising, we're creating new pathways that bypass some of the problematic pathways. It may make movements more automatic. So the more you move, the less you rely on step-by-step planning, and the more the movements become automatic. And that again can bypass some of the problematic areas. Exercise releases growth factors in the brain. So again, forming new connections, there's actually chemicals that allow the brain to grow that exercise releases. And exercise releases dopamine, which is the main chemical that is deficient in Parkinson's. And so when you exercise, you're actually releasing more dopamine. and it addresses the mind and the body together. So I mentioned there's both problems with motor function and non-motor function. Well, here's a way, instead of just focusing on one, we're dealing with the motor and the non-motor, the mind and the body simultaneously. There's evidence from this from looking at functional scans. So different from like an MRI, which looks at just the structure of the brain, there are special kind of scans called functional MRIs. There's also PET scans. These look at how areas of the brain are, how active are certain areas of the brain. In this study, they looked at 35 people with Parkinson's, and they randomly assigned them to get aerobic exercise for 3 months or a control group, which was just doing some stretching. And they did these functional MRIs to see the areas of the brain that light up in terms of their activity level. Those who were in the aerobic activity group, their cells in their brain were more responsive or more sensitive to dopamine, and they released more dopamine. And so not only are they releasing more dopamine, but the dopamine is having a stronger effect on them because their cells are more responsive in the exercise group. So it's changing the way the brain responds. In this study, we have 8 habitual exercisers compared to 9. So it's a very small study, I'll say that, but 8 habitual exercisers versus 9 sedentary people with Parkinson's. And they did PET scans. So again, looking at sort of how the brain functions and metabolizes energy. And they showed that there was a greater dopamine release in the habitual exercisers compared to the sedentary people, and a greater activation of dopamine pathways. So we're releasing more dopamine, but the pathways for dopamine are also changing their sensitivity. And so in a condition where you're naturally losing dopamine, you're able to change your brain to make it more sensitive and responsive and release more dopamine. And that's very important. What about non-motor benefits of exercise? Well, this is true for anybody, even people who don't have Parkinson's disease. Exercise is important in reducing fatigue. So it's while you may feel too fatigued to exercise, exercise can help with that fatigue. Exercise improves mood. It releases natural endorphins, natural opioids that actually improve your mood. It improves your cardiovascular health, which makes it easier to manage your Parkinson's disease. It has natural immune fighting, anti-inflammatory effects. And there's, depending on the type of exercise you do, there may be a social benefit in terms of social interaction. And so all of this together means improved quality of life. So why aren't more people with Parkinson's exercising? Why do we see that the trend is for exercising to be less than the average in people with Parkinson's? Well, some studies in the past have shown that it's because of not enough time, poor access to exercise, fear of falling. We did our own survey recently, and we published this last year, of more than 100 people with Parkinson's who were non-exercisers compared to more than 100 who were exercisers. And we found that that those who were not exercising reported more fatigue and depression and lack of motivation as the reason that they were not exercising. This is very important because these are problems that we see in Parkinson's disease. Fatigue and depression and lack of motivation can be part of the disease. But there are also problems that exercise can help. And so we're finding that people are not exercising because of these problems, which are specifically problems that exercise is good at helping. Studies have shown that these non-motor symptoms like depression, like cognitive impairment, like fatigue, these are the problems that if you follow people with Parkinson's, in this particular study followed people for over 20 years, these were the problems that had the biggest impact on quality of life in Parkinson's. Not the tremors, not the mobility issues, but the depression, the cognitive issues. This is what had the biggest effect on quality of life. If we look at how often people have these are the non-motor, these are some basic buckets of non-motor symptoms that people with Parkinson's experience: mood disorders, lightheadedness, which is autonomic dysfunction, low blood pressure, in other words, cognitive impairment, fatigue. I mean, you can see the percentages I've listed here. At least a third of people with Parkinson's disease experience any of these particular symptoms, and many people can experience many of these. And so they're common, and they need to be addressed because they have the biggest effect on quality of life. But they can be really difficult to address. And we have sometimes medications that can help with some of these, but that doesn't fix the problem for most people. And if exercise can help with both motor and non-motor symptoms, it needs to be considered. Here's an example of 6 or 7, this is a summary of 7 different studies which looked at the effects of exercise on mood. I mentioned depression is seen frequently in Parkinson's. At least a third of people have depression. All of these different studies looked at, you're not meant to be able to kind of look at these in detail, but I'll tell you, these are all studies that looked at different forms of exercise compared to not exercising or sedentary life. And they looked at mood outcomes like depression scores. And what you can see in the main results column is improvement in most of these studies. There's only one exception, which was the one in the middle that says no change. But the other ones show improved mood, greater reduction in depression, reduced depression, improved mood, if you look through all of them, in the groups that were exercising compared to the groups not exercising. So exercise in all of these studies except for one, which had no change. All of the others showed reduction in depression in the exercise group. How about sleep? Here we looked at exercise compared to sleep hygiene. So what that means is basically education about sleep, about what the best strategies are to improve your sleep hygiene, and compared that to exercise and looked at sleep outcomes. And the group that exercised, you can see on the left, had better sleep efficiency, had less wake time after sleep, had better total slow wave sleep. So all of the measures of sleep were improved in the exercise group compared to the group that just got education about exercise. How about cognition? This was a study that looked at the general population of people and followed who developed cognitive problems and what were the risk factors for getting cognitive problems. So this is not specific for Parkinson's disease. This was in the general population. And so one thing they found was cognitive activity in midlife. The more cognitively active you were, the less risk you had of developing dementia, Alzheimer's, things like that. That doesn't surprise us. But we also found that more physical activity in middle life was associated with less risk of dementia, and that's important. So exercise, physical activity, was associated with less risk of dementia. And it didn't have to be physical activity that you started from childhood or your whole life, but even midlife physical activity was associated with less risk of dementia. So what kind of activity should you be doing? Is one type better than another? And here you see an example of lots of different kinds of activities that many of you may be familiar with. When I asked our patients what they were doing, we saw that most people were describing walking as their main form of exercise. Some were doing strength training, some were doing cycling, and then I've listed some of the others, including dance, Tai Chi, and a few other things. And what you can see also is that those who were regular or high exercisers tended to do more of the high level exercise, like strength training or cycling, whereas those who were lower exercisers tended towards the lower activity like walking. But in general, this is what people in my practice seem to be doing when they are polled. So where's the evidence? First of all, big therapy, which is a kind of physical therapy for Parkinson's, has good evidence for benefits. This is not classically considered exercise, it's considered physical therapy, but it's really important. It focuses on large movements, large amplitude movements, which helps you overcome some of the slowness and small movements that are natural to Parkinson's disease. There's also good evidence for progressive resistance exercise, in other words, strength building exercise in Parkinson's disease. So these have good studies that support their benefits in Parkinson's. There's also some more unconventional forms of exercise which have good evidence for benefits. Some of these are smaller studies, but still beneficial. So tango and dance in general has been shown to improve balance, initiation of movement, overall motor scores in Parkinson's disease. This was based on a few studies. One of them that I referenced here is a study of 19 patients, so not a huge study, but still beneficial. Dance requires balance. It requires attention to control movements, and some forms of dance require interaction with a partner, and all of that can be beneficial in itself. Also, it incorporates music, which you're going to hear more about, and music itself can have beneficial effects on mood, quality of life, and motor function, and you'll hear more about that later today. How about boxing? A lot of you have heard about boxing and rock steady boxing in particular. So this is forced intense exercise that can improve balance, coordination, speed of movement, agility, strength, focus. So it has a lot of potential benefits. This was a study on rock steady boxing in 31 people with Parkinson's who were randomized to 12 weeks of boxing compared to other forms of conventional exercise. And in this study, only the boxing group had significant improvement in gait, speed, and endurance. And there were also improvements in both groups in balance, in mobility, and in quality of life. So we wanted to do a bigger study. We did one of 2,000 people with Parkinson's who do rock steady boxing. This is not yet published. So this is under review for publication right now. So of these over 2,000 people, what we found that rock steady boxing they reported improvement in their social life, in fatigue, in fear of falling, in depression, in anxiety. These are the percentages of improvement that they reported with rock steady boxing. They improved in their self-efficacy, in their quality of life, and 99% of these 2,000 people who participated recommended it to other people. If you look at on the right, I have the graph. Look at all the different symptoms, and this is the percentage of people who reported improvement in any of these specific symptoms with boxing. You can see motor symptoms and non-motor symptoms are represented here. You can see tremor, 43% of people. You can see anxiety, 58% of people. And why is this important? Remember what the barriers were that my patients were reporting for exercise. They said fatigue, they said low energy, mood, fear of falling. Those were reasons that they were not exercising. But look at the benefits that people who are exercising are reporting for those specific problems. How about intensity of exercise? Dan Korkos, who's a scientist here at Northwestern, has published importantly on the intensity of exercise. And he compared low intensity to higher intensity. And by higher intensity, he's talking about getting your heart rate up to a higher heart rate. So aerobic activity that gets your heart rate up. And he saw that the slowest decline in motor function was in the higher intensity group in people with Parkinson's. So the higher the intensity, the more beneficial the exercise was for people who are able to do the higher intensity exercise. And he's embarking on a bigger study, national study now, to study this further. And then there's mind-body intervention. So again, less conventional, but the idea here is exercise that in some way also incorporates meditative effect or spiritual effect that also can improve the non-motor symptoms like anxiety, like sleep. And some examples I've shown here, like Nia or yoga as examples. Let's start with Tai Chi. Tai Chi is a Chinese martial art. It involves some meditation. It involves balance-based exercise. It focuses on slow, choreographed movements, on breathing, on maintaining postures, on shifting your weight in different ways. And it has been proven to improve balance and motor function in Parkinson's disease. This got published in the New England Journal of Medicine, probably the best scientific journal that we have in medicine. And what they did was, this was the data from that study. They compared Tai Chi to conventional resistance exercise and to conventional stretching exercise in people with Parkinson's. And if you look at the total number of falls overall that the whole group of people had, they had 65 people in each group, and how many falls they had over 6 months. Look at the Tai Chi group, 62 falls over 6 months in the whole group, compared to the resistance and the stretching groups, 133 falls and 186 falls. So significantly fewer falls in the Tai Chi group compared to the other exercise groups. So if you're afraid of falling, this is good proof that Tai Chi is helpful for balance and fall risk. We did a small study here at Northwestern on yoga for Parkinson's disease. We saw in a 12-week study, we saw improvement in motor function, but we also saw improvement in anxiety. So again, that combination of helping motor, but also non-motor symptoms. So what are general strategies? Because what I'll say here is there is not one magic recipe for the kind of exercise you should be doing. So is there a theme? Is there something you should be looking for in the specific form of exercise that you choose to do? Well, I think involving a goal-based practice for acquiring a skill is beneficial, because when you're learning a new skill or a new strategy or a new exercise, you're learning something that's good for your mind as well as your body. It's good for your cognition, but it's also good for developing new pathways and really optimizing that neuroplasticity that we talked about. I think a supervised environment where you can be helped with learning through reinforcement, where there's an instructor who can help you. Obviously, there's some limitations to that in the COVID era, but certainly when that's possible, I think can be particularly helpful to have kind of that reinforcement with a trainer or a specialist. I think it needs to be something you enjoy. I think it's hard to believe that you're going to reliably stick with something that you don't enjoy doing. So I think you got to think about, try different things and find something you actually are enjoying. Something social, I think, is an added bonus. There's a tendency in Parkinson's disease to want to be more introverted, to want to stay at home more, to want to engage less with other people. And again, when we're able to, again, in a safe way, beyond the COVID era, I think participating in things that are more social can be beneficial. I think having well-trained instructors who understand Parkinson's disease is important. You want instructors who understand that there might be risk of things like low blood pressure when you're exercising, freezing of gait needs to be taken into account, the different specific things that people with Parkinson's experience that need to be taken into account with an instructor. And it needs to be appropriate to your level. I talk about the importance of high intensity exercise, but if you're wheelchair bound, you might not be doing high intensity exercise, but there's going to still be important exercise that you can do, and it needs to be targeted to your particular abilities. So this is the exercise prescription that I give my patients. I will say, if you're not exercising at all right now, then doing all of what I've listed here on this exercise prescription is probably too much to just jump to. This is sort of an ideal scenario and something to work up to or work towards. I think I wrote here keeping active in general, finding physical activity that you enjoy. I said aerobic activity, at least 30 minutes of moderate intensity to get your heart rate up 5 days a week. That can be a brisk walk, cycling, boxing, swimming. It can be whatever you enjoy. Some strength building, so using weights or resistance, 30 minutes twice a week. That can be with a trainer or a therapist who can show you certain techniques like squatting or lunging or rowing. And then balance training, considering Tai Chi or yoga or dance for 30 minutes a couple times a week. And that has those mind-body benefits that can be preferable. So with that, I'll just kind of conclude with a summary. So motor and non-motor issues in Parkinson's disease have an impact on quality of life. Exercise and healthy lifestyle can address the full spectrum of Parkinson's disease, and so it empowers you to be an active participant in your healthcare. Exercise can improve your quality of life and can slow down the decline in physical function, and it's an essential part of the treatment of Parkinson's disease, really not an optional part of management. It's just as important as the medications we provide you. And I will be around for the question and answer session at the end. And so with that, I will hand it back to Jessica.
Thank you so much, Dr. Bega. That was a wonderful presentation. We really appreciate it. Just give me one moment. I just wanted to take a moment before we get to our second presenter and take a moment to thank our sponsors today. I would love to thank Kiowa Kirin, Synovian, Lundbeck, Supernus, UCB, Amneal, and Accorda. These wonderful sponsors are really who make these programs free and available to all. And to learn more about these sponsors and the resources that they offer the PD community, you should check out our virtual exhibit hall. So if you go to www.parkinson.org/Greater Illinois/chapter supporters, you will see the logo, their logos, and all you need to do is click on that logo to get some detailed information of what they offer the PD community. So again, a big thank you to our sponsors today. All right, and now it is my pleasure to introduce our second speaker, Linda Jedrzejek. Linda is a board-certified music therapist, neurologic music therapist, and owner of RhythmWorks Music Therapy, LLC. For the past 10 years, she has been developing music therapy programs for various facilities and school districts throughout the DuPage County area in Illinois. She is passionate about her work with participants of Rush Copley Memorial Hospital's Movement Disorders Program, also located in Aurora, Illinois, and providing opportunities to treat symptoms of Parkinson's disease in a supportive and motivating atmosphere. Linda, thank you so much for joining us today.
Thank you, Jessica. Today I'll be telling you more about music therapy, why music is effective, and we'll be doing a demonstration where I hope you all participate. As I'm going to say later, no musical experience is required, just participation. It doesn't matter if you sing on key or know how to play an instrument. So let me tell you a little bit. Oh, first of all, I have no disclosures to report. In music therapy, there's an intentional use of music to address non-musical goals. A music therapist uses the elements of music such as tempo or rhythm in prescribed ways to help individuals either improve or maintain, depending on if it's a degenerative disease, goals that are not related to music. In order to become a board certified music therapist, you first need to earn a degree or equivalency at an accredited university, then complete a 1,000-hour internship, which typically takes about 6 or 7 months, and finally pass a board certification exam. Then you could be called a board certified music therapist. But you're not done. In order to maintain your credentials, every 5-year cycle, a music therapist has to complete 100 hours of continuing education credits. Now, music therapy is an allied health profession similar to speech, occupational, and physical therapy. And although music has been used therapeutically for ages, music therapy first gained recognition in the 20th century when amateur and professional musicians would go to the veterans hospitals and play for the thousands of veterans who are suffering physically, emotionally, and mentally. Their responses to the music was so notable that doctors and nurses began to request trained musicians to come and work with the patients. Now, there are other areas of specializations or disciplines, and one that lends itself particularly well to neurological conditions such as Parkinson's disease is neurologic music therapy, which was developed by Dr. Michael Tout. And that is a system of research-based techniques that are based on how music is perceived in the brain and then the observable behavioral outcomes. So what does this mean if you have Parkinson's disease? It means that we can use music-based interventions to either help improve or maintain vocal qualities such as articulation, volume. We hear that quite often, someone speaking with a quiet voice. Vocal range, pitch, if you're speaking with a monotone voice or perhaps have stuttering, can also be used to help decrease the effect of the Parkinson's mask and improve facial expressions. An area that I think is incredibly important where music is uniquely qualified to help with singing and vocal exercises is to help build respiratory strength. And this is incredibly important if someone becomes ill with a respiratory disease to be able to cough up the mucus before it becomes something like pneumonia. As the doctor mentioned about the movement issues, you might have weakness on one of your sides. It might have some challenges with balance or range of motion, and we can use music or music and exercise to help with those issues. There's also been a great deal of research on how a technique called rhythmic auditory stimulation helps with gait issues, and that is a pattern of walking. And lastly, of course, our sessions are designed to help provide social and emotional support. All right, so now why does music work? What about it makes it function? So we know that preferred music, which is defined as music typically from our late teens to early 20s, but it can be any song or music that's had an impact on your life, that preferred music increases dopamine in the ventral tegmental area. And this is important for 2 reasons. Number 1, we need dopamine in order to make new neuronal connections. And number 2, the ventral tegmental area is involved with neuroplasticity, which is also necessary to create new connections. Music, actually rhythm, the element of rhythm and a principle called entrainment also support neural synchrony. And that is when 2 neurons, in order to make the connection, have to fire in the same time. So this is what this would look like in a music therapy session. This is how music would support this principle. I would like everyone to either tap your toes or tap your leg and sing along with me. We're going to be singing "You Are My Sunshine." You are my sunshine, my only sunshine. You make me happy when skies are gray. You'll never know, dear, how much I love you. Please don't take my sunshine away. Now, how many of you are tapping to my beat? That is called entrainment. And entrainment is important because we know that if our body is moving to the beat that we're playing, that the neurons underlying those movements are synchronizing, and we can assume they are making connections. Now, the most important reason why music is functional and works is because it activates the whole brain. Here it says simultaneously, maybe not at all at the same time. If you're listening to music, you're activating your auditory cortex. If you have an emotional response, it might be your limbic system, or if you're tapping your foot, your motor cortex. So what this video is going to show, it's called Tango Brain, and it highlights up in red where music is, there's increased blood flow from listening to music. And this is a functional magnetic resonance imaging machine. So let's take a look. You can see that there's red is on both sides of the brain. And I know growing up, I was taught that it's only on one side of music production. So you can see that music is processed throughout the entire brain. And the reason why this is so important is because if there is an area that is damaged or not functioning right, we may be able to use music to access those skills and regain them using different neuronal pathways. In this video, it's going to show Representative Gabby Giffords, who had a brain injury from being a gunshot. And she's trying to say the word light and having a great deal of difficulty. So let's take a look here.
Now, in those early therapy sessions in Houston,
you turn on the light.
It seemed as though words had abandoned her.
Let's try this one. Watch me. Yes. Turn on the...
For those of us injured on the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Gabby, are you frustrated? Can I tell you something? It is going to get better. Okay? It's frustrating right now, but it is going to get better. You have come a long way in 5 weeks. You've come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're going to do this. You ready? This little light of mine, I'm gonna let it shine.
Remember, at this point, she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine. Excellent.
Well, good morning. Gabby, how do you do?
Megan Morrow is Gabby's music therapist.
Why is it that someone who can't speak can sing?
Because music is accessed in many different areas of the brain that aren't designated for language.
All right, so now we're going to move on to our demonstration portion of our presentation. And what we're going to do first is, I would like everyone, we're going to be raising our arms up and down. What we're going to be working on first is range of motion. And then we're going to do a little bit of balance. Now, in your music therapy session, you may not be doing these sequentially in a row. Your music therapist is going to design interventions based on your goals and your needs. But for the purposes of our demonstration today, I wanted to show you how some of this would look. Also, I'm using well-known music. Your music therapist is going to choose songs based on your preferred music and songs that will help fit the needs that you're working toward. So we're going to be raising our arms up high and down, and then we're going to be moving side to side and singing My Bonnie Lies Over the Ocean. So if you can raise your arms up and down, up and down. My Bonnie lies over the ocean. My Bonnie lies over the sea. My Bonnie lies over the ocean. Oh, bring back my Bonnie to me. Now we're gonna go side, 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 side. Bring Bring back, oh, bring back my Bonnie to me, to me. Bring back, oh, bring back my Bonnie to me. Now this instrument is called an auto harp, and it's used quite often because it's really effective in supporting movements based on the strumming pattern that we play. All right, another intervention that we use quite often is therapeutic drumming, because rhythm helps organize the brain. We also work on crossing midline, because when we're crossing midline, we're promoting communication between the right hemisphere and the left hemisphere of the brain. In our sessions, typically when we're working in person, I would hand out a couple of drums and mallets to the participants, and we would partner up and have one partner hold the drums like this, and the other one is holding their mallets, and then using the drum to target where they're going to play. So since we've been remote, Rush Copley has been kind enough to supply instrument kits to their participants. And what we're going to do today is just a brief demonstration of what we would do for crossing midline. So we're using these instruments as targets. And so we're going to reach across. If you're at home and you don't have instruments, that's fine. You can just practice, make a target on your table or in the air, or you can have someone stand like this and use the palms of their hands as the target. And we're going to sing Yellow Submarine. We're going to cross, down, cross, down. We all live in a yellow submarine, a yellow submarine, a yellow submarine. We all live in a yellow submarine, a yellow submarine, a yellow submarine. And you saw them reaching across and not just here, and that's helping to hopefully build those neuronal connections. All right. Now, people quite often come with to me with issues of volume and wanting to talk in with a louder voice. And one of the ways that we help promote that is by teaching them to raise the soft palate in the back of their throat. And to do this, it's very easy to feel. Just go like this, like make a surprise. This is also helpful when you're raising the soft palate. It's helpful with swallowing issues because when you raise it, it prevents food and liquids from going down your windpipe. Another thing that we do to help emphasize and get people used to what it feels like to raise their soft palate is yawning. Like, it's probably the only therapy where you're encouraged to yawn. So we would yawn like this, and then please sing along with me. We're gonna sing and yawn at the same time. We're just gonna be going, ma. Here we go, ready? Ma, ma, ma. And what research has shown is that singing helps keep the muscles of the larynx activated longer. And so perhaps this will be important when it comes to swallowing. More research has to be done, but it's a great start. Now, we always try to incorporate some songs, also therapeutic singing, in order to work on these skills. So when we're working on volume, we want to choose a song that gives the opportunity to sing in or speak in a loud voice. So for today, we're going to be singing Sweet Caroline. And at the part where we go, Sweet Caroline, we're going to be bum, bum, bum. So a little bit louder. I don't want you to strain your voices. I'm also fist pumping to give some extra physical emphasis. So we're going bum, bum, bum. Good times never seem so good. So good, so good, so good. And I encourage you, if you're ever doing this at home, to sing, say, a quiet voice, a medium, and then louder, and tape yourselves, because sometimes we think we're singing or talking loudly, but we're not. So here we go, everybody. Sweet Caroline, bum, bum, bum. Good times never seem so good. So good, so good, so good. I've been inclined, bum, 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 to believe they never won. And we always try to incorporate, as I said, songs that are familiar. And if also we use newer songs to help with cognition. All right, an area that, as I mentioned before, I think is very important to work on is building respiratory strength. And we do that by building the respiratory diaphragm right here, the diaphragm muscles involved with respiratory strength. And we're going to do an exercise right now where I want you to breathe in through your nose for a count of 4. And then we're going to breathe out through our mouth for a count of 4, doing this. Shh. Then we're going to breathe in again for a count of 4, but breathe out for 8, etc. And what this is doing is this is helping to build the muscles of the diaphragm, the diaphragmatic muscle. So let's try this. Ready? So breathe in and out for 4. Shh. Breathe in. Out for 8. In for 4. Out for 12. And so on. Another technique that we use is lip trills, and they look like this. Now, this skill may be challenging at first. It might take some practice. You might need to press here to help. And when you can do the lip trills, that means you're getting enough air to push it out, and your lips are relaxed enough. And a song that we use to encourage this is the Lion Sleeps Tonight. So I want you to do for the verse, we're going to be doing our lip trills. When we get to wee, oh, one more way, I really want you to extend your lips out as wide as possible because we're going to be helping our facial muscles by doing that. So I know I might look ridiculous, but it's part of the process. Here we go. Ready? May also bring out instruments like kazoos or harmonicas, and those are for semi-occluded vocal tract exercises. And what that does, that's a fancy name for saying that your mouth is partially closed. And when we do that, there's increased pressure that goes back from the lips to the vocal folds, and that makes them vibrate with more ease and less effort. Lastly, we're going to work on improving vocal range, pitch, and also show you a technique for helping articulation. And we use simple exercise called a glissando, which is a slide. Your voice will slide from low to high to back down again. So you might do, or in my groups, we might do, oh no, or oh yes. And a song that is really great for articulation and also improving pitch is Tutti Frutti. Now, when you're singing this, I want you to over-articulate the Tutti Frutti, all Rudy, really over-articulate. And then when we do the woo, activate your whole face. Your eyebrows go up. You know, we're trying to use our whole face and expression when we're doing this. Here we go. Are you ready? Tutti Frutti, all Rudy. Tutti Frutti, all Rudy. Woo, Tutti Frutti, all Rudy. Tutti Frutti, all Rudy. Woo, Tutti Frutti, all Rudy. A wop, bop, loo, bop, a wop, bam, boo. All right, that brings us to the end of our demonstration. Let me share the screen back. All right, as I mentioned before, if you have gait disturbances or bradykinesia, rhythmic auditory stimulation is a technique that has a lot of research behind it to help facilitate those movements. It can be used if you get stuck, like say you're coming to a different pattern, or you're at glass sliding doors or at a light, or just to help you initiate movement. It can also be used to help achieve more functional gait patterns. Our sessions are also designed to help improve mood and decrease feelings of isolation, anxiety, and depression. I've been at Rush Copley now for 6 years, and it's a very safe space. We share our feelings, we share what's going on, and we laugh a lot and have that connection. We also provide opportunities for music relaxation to give people tools to take home with them, such as guided meditations, or we might use sensory-based instruments in an ensemble type of group and experience relaxation that way. Lastly, music therapy is interactive. You don't need any previous musical experience. It's just important to participate. You don't have to sing on key. You don't have to play perfectly. It's just come, participate, and enjoy the process. I have a few slides, some information if you're looking for more information about music therapy and Rush Copley's movement disorders program. Thank you.
Linda, that was fantastic. Thank you so much for just, I love presentations like this. I love the creativity, and it's fun and it's different. So thank you so much for taking your time to do that today.
My pleasure.
We really appreciate it. Well, now I would love to introduce our last presenter, Ashley Hildebrandt. Ashley is an art therapy supervisor at IU Health Neuroscience Center and is a contributing member of the Parkinson's Foundation Center of Excellence at the Indiana University School of Medicine multidisciplinary team. She works with patients in the neurology and movement disorder clinics to facilitate self-expression, develop healthy coping strategies to manage stress, increase social support, and improve quality of life. Ashley, thank you so much for joining us today.
Thank you so much for the introduction, Jessica. I'm really glad to be here today to highlight the work that we're doing at the Neuroscience Center. First and foremost, I do have one disclosure. My team at the Center of Excellence is a proud recipient of a Parkinson's Foundation Core Grant, which we are currently using to develop a new therapeutic arts program, which integrates art therapy, dance movement therapy, as well as the Parkinson's Choir, just to help improve quality of life for people with Parkinson's. A question that I get often as an art therapist is, what is art therapy? It's oftentimes a very misunderstood field just because it's not super well developed in most of the country. The American Art Therapy Association defines art therapy as an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. So to simplify that, in the words of my brilliant mentor, Juliet King, it ain't arts and crafts. There's a lot more than art making that goes into art therapy and helping guide people through this process. Art therapists have a very rigorous training. To practice art therapy, it requires a master's degree from an accredited art therapy master's program. And to enroll in these programs, there's a requirement for prerequisite credit hours in psychology and art. During the graduate program, we requires 100 hours of a supervised practicum, 600 hours of an art therapy internship. And then after graduation, to get credentialed, we have to have over 1,000 direct client hours practicing art therapy, 100 hours of supervision. And then after we do that, we get to sit for board exams. And then that's how we become registered board certified art therapists. And we also, just as Linda mentioned for music therapy, we do have ongoing continuing education just to make sure we stay informed. Art therapy is based on the theories of two prominent psychologists, Sigmund Freud and Carl Jung. Freud wrote that dreams are the royal road to the unconscious, tapping into aspects within us that are out of our awareness. And you can see that illustrated here in this iceberg. Our behaviors, what we convey to others, what we think is up here, but there's a lot more below the surface that informs that. Carl Jung, who was a student of Freud, took this a step further with his theory of the collective unconscious, which is what he described as the part of the unconscious mind made up of ancestral memory and experience that all humans have in common. So you can see this illustrated here in these pyramids, where the personal conscious relates to Freud's unconscious, and below that is the collective unconscious. And this is where Jung believed that things like symbols and archetypes were housed. And again, it is distinct from the individual. These are things that everyone has in common who's alive. These theories of the unconscious mind have also paved the way for projective testing, such as the Rorschach ink blot test, word associations, and other things you see like that. And a lot of projective tests are also used in the field of art therapy in the form of art therapy assessment. Trained art therapists can use assessments such as the draw a man, the person picking an apple from a tree, draw a person in the rain, to help gain a better understanding of what people might be experiencing. And it can also help us get a glimpse into what might be going on with people on a deeper level than they may be willing to talk about initially. The term art therapy was first coined in 1942 by a British painter named Adrian Hill. Hill was recovering from tuberculosis and continued to paint, and he really noticed the effects of art making on his wellness. And he was so captivated by this that he wrote a book in 1945 that was published called Art versus Illness. And this really got the conversation going in the UK about the impact of art and wellness, especially with physical illness and how it can assist with that. In the United States at around the same time, the field of art therapy continued to emerge. And this happened with the two women who are considered the grandmothers of art therapy, Margaret Nomberg, who is credited to art psychotherapy, and Edith Kramer, who is credited with artist therapy. And these two frameworks are what art therapists today work from. Art as therapy is based on the theory that art making and the creative process are inherently healing on their own. This can include things like coloring pages, building models. Many people find these activities to be relaxing and know that they can help clear the mind. In essence, feeling better and able to continue with their days with less stress. And I'll tell you a bit more later as to why these strategies can be effective. On the other hand, art psychotherapy is based on the theory that art is the vehicle for symbolic speech, which helps people gain insight into themselves and their behaviors. Art therapists are trained to use both of these different frameworks to best meet the needs of the individual they're working with and what their goals are. Art therapy, I know I'm biased, but it really does have many advantages, especially considering advantages over traditional talk therapy. One feature is that it can oftentimes be viewed as less threatening than traditional talk therapy, and that people can create, and then as they become more comfortable with that, their stress is reduced, they can feel more comfortable talking about things more directly. And because of that, we tend to see a lot more direct participation and experience than just talking alone. Another thing that I think is really invaluable, especially working with neurological populations, is that the art itself provides a visual record of treatment progress. In traditional talk therapy, the only record of the session is typically the therapist's progress notes, which the patient doesn't have access to. So if a person's under some distress, or if they have memory deficits, it can be hard to remember and recall what's already happened. And it can really be invaluable to keep that record for patients to have to review over time so they can pick up where they left off if they do have memory deficits, or even to see their physical progress over time, to have that reflection, because progress can definitely be incremental. And another thing we frequently observe as art therapists is a client might, come in and present, lethargic, low energy level, and as they engage in the art process, we oftentimes see people's energy level improve greatly. They'll be more engaged. They'll be speech becomes clearer. People are sitting up more in their chairs. They're really activating their whole body in what they're doing. Part of this is because art making does impact a lot of systems in a lot of different senses. It involves thinking, it involves emotion, the kinesthetic qualities of making art, motion, feeling the clay in your hands, feeling the paintbrush, feeling the paint move on the canvas, and also the perception that goes into it. And with this, integrating all these systems, it can help integrate them all together, which can promote balance and insight. And the value of it, again, I just think is just incredible. I've been in this field for 12 years now, and I still get amazed by what the art process can do for people with a variety of challenges. But today, I will speak more as to the impact of art making on the brain. Art making has been shown to activate both sides of the brain, and it helps forge a mind-body connection. This connection can foster increased self-awareness. It can help improve with problem-solving skills and also help people gain insight. Art therapy can also help promote neuroplasticity, which Dr. Bega talked about earlier today, keeping in mind that repetition creates evolution within the brain. And this can take the form of changing habits, thinking about something differently. It can target not only cognition, but also motor skills. If a person is holding a paintbrush, they're doing this over time, that dexterity can also improve in that process as well. By now, we're well aware that visuospatial dysfunction is common in Parkinson's disease, which oftentimes contributes to problems with gait and other motor symptoms. And there's a growing body of research at this point studying this, and the mechanisms in art making has been shown to enhance visuospatial functions for people with Parkinson's. And there's research going on currently now seeing how this does impact further those motor symptoms. This is one that I find very fascinating. This is research done by one of my professors at Drexel University back in the day. She found that 45 minutes of art making has been shown to significantly reduce cortisol levels in the body. Cortisol is a stress hormone, and it can contribute to depression, anxiety, and a whole slew of other physical conditions as well. And this is also just not done by trained artists. These are just normal, everyday people, people who are not trained as artists, even doing activities such as coloring pages. So again, only 45 minutes of this and people's stress just dropped. And a lot of that is because of the cortisol. not only making artwork can be helpful, but the field of neuroaesthetics also shows that viewing artwork can also have a big impact on the brain. There was a study where people, there was imaging on people who were viewing paintings that were, described to be beautiful to them. And it showed that dopamine reward center and areas of the cortex associated with positive affect were shown to activate when viewing these pieces of art. And interestingly enough, the brains tended to activate more while looking at the paintings of Monet. So aesthetic properties in the artwork, are also able to help shift mood and affect for this reason as well. Art therapy has been shown to improve a variety of symptoms of people with Parkinson's. One thing is mood. A lot of times, we can use art therapy as a means of treating anxiety, depression, and oftentimes in session, we can also watch this change while people are creating artwork. Self-confidence is another big one. We're focused more on what people can do rather than their limitations. And this can also provide an outlet for people to do something on their own, independently. So art making is something that they can do and they don't have to rely on a care partner to help them or do it for them, which in turn absolutely impacts quality of life. Concentration is something that we also see improve while creating artwork, and developing a sense of self, connecting more with their own identity. And there's also a big social component to it as well. Art therapy can be done on an individual basis, or it can also be group. And group therapy can absolutely be very beneficial in helping foster the awareness that people are not alone in their experiences, and can assist with the isolation people are experiencing, especially right now with COVID-19. There are many art therapists who are working in a virtual format, and there are also virtual groups happening too. Another thing that is very helpful about art therapy, specifically with Parkinson's, is people who have trouble with speech can use art therapy as an outlet to communicate what they're experiencing, and it can help them be more understood and feel more understood by their loved ones. Motor symptoms have also been shown to improve. Of course, with manipulating art media, dexterity has been shown to improve. Tremors can also be reduced through art making. Tremors are oftentimes worsened by fatigue, stress, emotional distress. And it's not uncommon as people are creating artwork, their stress levels reduce, therefore their tremors reduce while they're engaged in that process. It's a pretty amazing thing to see. Art therapy can also assist with freezing. Because art therapy introduces movements that are out of a person's everyday norm in their experience, it operates the body less on autopilot, which helps reduce the freezing. And we already spoke before about visuospatial perception. Another thing I love about art therapy is that there really are no limitations. It requires zero talent or experience. I hear on nearly a daily basis working with patients, things like, the only thing I can draw are stick figures, I can't draw a straight line, or my personal favorite, the only thing I can draw is flies, but it really doesn't matter. It's more based on the process of creating it rather than the finished product. That's where people really tend to gain the most insight, is through their experience of creation. There are also many, many different ways that people can create art, even without traditional supplies. This is something we've had to get creative with in our department with COVID and working virtually, unable to get supplies to many of the people that we meet. An example you can see here on the right is the work of our current intern from George Washington University. She arranges things and photographs them. So this is a mandala that she made with materials found outside her home. There's really no limit to what you can do. To find an art therapist near you, here's some information. I've heard wonderful information too about the Parkinson's Foundation helpline and assisting people connect with an art therapist near them. There's also an art therapy locator on the arttherapy.org website. That's wonderful. Thank you so much for your time and having me here today.
Ashley, thank you so much. No, we appreciate that. And in full disclosure, my undergrad was in art, so I am so partial to these creative therapies. So thank you so much for that wonderful presentation. So now we are going to be doing our Q&A segment. So we'll invite Linda and Dr. Bega back up. Great, I see everyone. So we have many questions. So I'm really excited to ask all of you these. So this one, I'm going to have Dr. Bega answer first, but I also would like to have Ashley and Linda answer as well. So we had an attendee ask or say, many exercise programs are not available because of COVID. I live alone and feel there is a blunting of my mental status. Can you let me know where to find these PD exercise programs?
Sure. So I don't know if this helps, but you're definitely not alone. I'm seeing this. The whole year has been really difficult on a lot of my patients. I think because of the isolation and less activity, I'm seeing more confusion in my patients. I'm seeing more deconditioning in my patients. It's pretty apparent that COVID has had that effect. It's not ideal, but in terms of the options that we have to offer, different things though to think about. One is what looking first at the places that you're used to getting your exercise or the facilities that you've gone to before, whether it's locally, places like the Shirley Ryan Ability Lab, whether it's Movement Revolution, whatever Athleticos or community places that you've been getting your exercise at. Reach out to them and make sure that there aren't virtual options if you do have the ability to do virtual options. Because most of them are, many of these programs wouldn't stay afloat if they didn't have virtual participation. So as an example, I know Movement Revolution is offering virtual programs for their participants who normally would come in and do rock steady boxing. Some of them are doing small group sessions to avoid kind of having a lot of people together, but understandably, people may feel uncomfortable even with that. And so reach out to those places and ask what virtual offerings they have. At your center that you get your care, reach out to the social workers. I know, for instance, we have a handout that we've been kind of compiling of different online resources, whether it's YouTube videos, whether it's programs that different foundations have, such as the Parkinson Foundation, but also some of the other foundations, whether it's Davis Finney, Brian Grant, some of these other foundations also have online exercise options. Those of you who are not as comfortable or don't have the regular access to online options, I think that may be a limitation, in which case the question is, what can you do on your own at home in the meantime? I say in the meantime, I'm very hopeful that next year we will be kind of being able to get back to our group classes. But what can you do at home in the meantime? Do you have the means or the ability to get a machine at home? If you do, the kinds of exercise machines that you can invest in, things like a recumbent bicycle or stationary bicycle, you can get a lot of use out of an elliptical machine. I like recumbent bikes or stationary bikes because if you do have balance issues, nobody has to be near you or worrying about falls. You don't have to worry about low blood pressure. And you can still get a good workout. Don't underestimate what you can do even in a seated workout, because you can get aerobic out of that, but you can also get strength building. Depending on the machines, you can move arms and legs with them. Stretching bands that you can get at home and get resistance with, or light weights. A lot of these are not necessarily the most fun forms of exercise, but it's certainly useful to try and find things that you can do at home. And then the last thing is, if you don't have the means or resources to get a machine at home, understandably, there's still some low cost equipment. That's why I mentioned things like resistance bands, things like little pedaling devices that aren't necessarily a bike, but I've had patients get these smaller pedal machines where you can just kind of pedal on the machine in place, and they don't take up a lot of space. So there are options. The other thing is talking to in addition to the social workers at your centers that you get your care, is the Parkinson Foundation hotline also for some suggestions.
Great, thank you so much, Dr. Bega. And so I kind of want to ask the same question to both of you, because we've received a lot of questions just asking, how do I access these programs online? So Linda, someone had said, are there YouTube sessions with some of the music exercises mentioned that we can play along with? She said they said all are terrific, by the way. I wanted to point out that compliment. So Linda, I'll have you go next and just talk about ways that people can access this information.
There are some YouTube videos. Music therapist Carolyn Dobson, I think she's out of Texas. If you look up music therapy and Parkinson's disease group, it may come up. I can send you the spelling of her name if you type her name into YouTube. She has 2 videos that actually go through a whole session. And there might be a few others. Drums Alive, I think, does something on Golden Beats, if you look Golden Beats. And they use the big yoga balls and to drum. You don't need all of that equipment. You can do it simply by, accessing your table or a desk or something. And I have one client that uses like markers to drum with. And I would also recommend checking hospitals in the area. Rush Copley's Movement Disorders program has all of their exercise programs, music therapy. They have a support program online. Maybe Northwestern has something similar, or individuals, hospitals. Yeah, is that helpful?
Yes, great, thank you. And Ashley, I will pose the same question to you. How can people access art therapy online?
Sure. Right now with COVID, most art therapists around the country are working virtually. And the beauty of that is that you might even be able to, if this is something you want to pursue, to be able to connect with an art therapist who's even outside of your area. So let's say if you live in a rural area of the United States where there isn't a local art therapist, you might even be able to connect with someone in a city, who is able to provide those services right now. And that is one benefit of where we are. We're able to provide more services for people who might otherwise have difficulty connecting with them. You can, again, find an art therapist through the Parkinson's Foundation helpline, and also through the Art Therapist Finder, which, Jessica, I really hope you'll include that in the resource list. And of course, art making too in itself, does have its benefits, and you can do it with virtually nothing. Just going around your home, seeing what you have, things like a pen, paper, doodling, making models, things like that can really help. And another interesting thing about the COVID era too is that many art museums around the world do have free virtual tours of their entire collection. So really taking advantage of that, and you can also get the benefits of neuroaesthetics too, and reducing stress.
I said that we're starting virtual art therapy classes in January 2021. It's going to be the 3rd Monday of every month. And if you want information on that, Jessica and PF have our social workers info and can connect you if you want information on that.
I also want to echo what Ashley said, and that music therapists are now working online also if people are looking for music therapy sessions.
Great, thank you to all of you. So we will include all of these resources in a follow-up email, and just so people can access this all in one place. Dr. Bega, should you increase or intensify exercises as the disease progresses?
I think that you need to adapt or adjust the exercise as the disease progresses, not necessarily increase the intensity. As I said, usually people who are a little younger and earlier in the disease are able to do a bit of a higher intensity exercise. And so you want to maximize that as much as you can, because we know the higher intensity, getting your heart rate up is even more beneficial than the lower intensity. As you get older and as Parkinson's disease advances, it's natural that you're not going to be able to do the same level of intensity. And so sometimes we need to adapt to things like, again, seated exercise in some cases. If over time balance is more of a problem, then kind of adapting in that way. I will say though, people get discouraged by that. I find a lot of value in some of those adapted exercises that people with more advanced disease can still do. Seated exercise in particular, I mentioned a few times. I know, like rock steady boxing actually has, when they're active, they have different groups for, they even have a seated exercise boxing group. Other forms of exercise can be adapted to deal with different limitations that you may have, again, whether it's blood pressure, whether it's balance. So it really just requires adapting to your needs, but it's not that the level of intensity needs to keep going higher and higher over time. That's typically not how we recommend it.
Great, thank you. Ashley, I am an art therapist and my whole family are musicians. So actually this can go to both of you. Can you give suggestions for us to help our father who has Parkinson's? Perhaps give ideas of what we can do at home simply.
One practice that I personally really love is based on the work of painter Paul Klee. Klee would put on jazz music, and then he would use this approach that he called taking a line for a walk to see where it goes. So you take a big piece of paper, a big canvas, put on the music, and then just move your arm to the rhythm of the music, and then you have a visualization of the music. From there, you can fill it in with color. You can, look at the scribbles and try to find things within. Things like that can really be beneficial in just getting the creative energy going.
That's wonderful. Thank you. Linda, can you give a suggestion?
Yes, I would say encouraging singing their favorite songs, and while they're singing, incorporating a rhythmic aspect like tapping to the beat. If they're walking and they're getting stuck, tapping on the shoulder or encouraging to sing a favorite song that's in a steady beat, like we did, "You Are My Sunshine, My Only Sunshine." And that, as you get that into your brain, then that will help prime the brain to move, the body to move, excuse me. Yeah.
Perfect. Thank you. Dr. Bega, if one is experiencing freezing, how do you exercise?
Yeah, I think freezing of gait, which is sort of, for those who don't know what that is some people with Parkinson's experience this tendency for the feet to feel kind of stuck in certain positions and trouble initiating the next step. There are circumstances that tend to bring it out more for people. So narrow spaces, thresholds like doorways, turning tends to be a common place. So one is identifying the triggers and the situations that tend to bring it out and try and adapt the environment as much as possible. Try and make sure that there's not clutter around, that you're maximizing the space that you have so you're not in narrow spaces. Putting markers, like colored tape and things around your house to give you cues visually to overcome the freezing, because it's not a physical limitation. It's a connection problem, the way the brain is communicating with the legs in those particular periods of time. And so you can bypass it. You can retrain the brain to bypass the circuit that's sort of getting stuck. And so visual pathways are one way that you can bypass it. Actually, auditory pathways are one way where you can bypass it using rhythm. There's been studies looking at metronomes. Just the kind of the beat of a metronome can help you overcome a freezing episode. And so could you incorporate music in a way in your exercise routine to overcome the freezing? So you can work with therapists that can really, again, that's why it's important to have therapists who know Parkinson's, because they can address that using rhythm, using visual cues to help overcome it. I think it is particularly important for people who have freezing problems to exercise, because balance tends to be an issue for people who freeze. And also Tai Chi, I mentioned, because Tai Chi, you're standing in place. but you're improving your balance standing in one position. So very amenable for people who have freezing.
So Dr. Bega, I'm just going to kind of piggyback on that because we had another question that was talking about dizziness interfering with exercises and causing many falls. So, and you had mentioned, you know, a stationary bike or recumbent stationary bike. Is that kind of what you would suggest still in a situation like that?
Yeah, it's a common problem with Parkinson's that the blood pressure has a tendency to drop when you stand up. So a few things, make sure you're staying really well hydrated. You know, exercise can be dehydrating if you're sweating, which is a good thing to be sweating, but you really gotta take extra fluids in. And then you never wanna do exercises that make you change positions over and over again very quickly. So things that make you go from sitting to standing to sitting to standing to sitting to standing, that's gonna exacerbate your blood pressure drops if you're tending to do that. So so being aware of that and kind of doing more of your exercises that allow for slow standing up to avoid those blood pressure drops. But if you're going to be exercising alone without someone supervising you and you tend to drop your blood pressure, then definitely try those chair-based exercises. The chair-based boxing, the chair-based strength exercise, the pedaling, all of that is really convenient for people who tend to drop their blood pressure.
Great, thank you. And I do want to give a plug again for our PD Health at Home program, because at parkinson.org/PD Health, we do have Fitness Fridays, and they upload these new 12-minute videos, and a lot of them are also based on what level you can do. So it's a great resource to check out. Linda, next question is for you. Is music therapy covered by Medicare or insurance in general?
If it's prescribed by a doctor, it could be. We're still in the initial stages of getting coverage, but it really is specific. So you'd have to check with your music therapist, and then they could work with your insurance company to see if it is covered or Medicare.
Ashley, would that be the same for you?
The same goes for art therapy. They're currently working on getting it covered by Medicare, but a lot of private insurance does accept. But the beauty of the Parkinson's Foundation is that there's art therapy available in a number of places and services are free. So I would definitely encourage to look there first.
Great, thank you. Ashley, next question is for you. Any specific directives in art therapy that are your go-to directives to help clients begin when working with clients with Parkinson's? I am also an art therapist working with PD clients, but I also sing with them.
The exercise that I mentioned before, I really like. Just using movement music, you know, just to kind of get it going. Starting with scribbles, again, can be a good way to start and get people relaxed and going from there. Aside from that, it really varies working with the specific person I am because everyone has a different goal.
Great, thank you. Dr. Bega, can you distinguish between low intensity and high intensity as it affects the benefit from high intensity interval training in general?
Yeah, so the person who's published the most on this is Dan Korkos, who we're lucky to have in our physical therapy department here. He's published on this, and you can easily find his publications. He's actually running a national trial right now called SPARX. SPARX, and they're actually recruiting people to participate in this trial now who are newly diagnosed people with Parkinson's disease to study high intensity versus low intensity further. But in his work, he's seen that they define it by getting how high you get your heart rate. And so high intensity is considered 80 to 85% maximal heart rate. There's a way you can, that a trainer can calculate that. You can calculate that yourself actually too. It's based on your age. And getting to 80 to 85% of the maximal heart rate that would be based on your age. And so if you can get to that and be at that for the majority of your exercise, that's considered the high intensity that we want people to get to. Not everybody can do that. There might be personal limitations, cardiac issues, pulmonary issues that a person may have that may prevent you from being able to get to that. That doesn't mean that you're not getting benefit from your exercise. Again, we're just comparing, we're trying to find out what's the best form to do if you're able to. But don't feel like, I have plenty of people who feel that walking is as much as they can do in terms of getting short of breath, getting tired. Believe me that walking is better than being sedentary and not doing anything. But you should have an individual discussion with your doctor about what is the higher intensity that you can personally get to, and what ways can we do to optimize that for you. Wouldn't get too fixed on the heart rate and the numbers unless you're working with a trainer. They can kind of look into that. But one easy way to know if you're doing kind of moderate to high intensity exercise yourself is if you're a little short of breath when you're exercising to the point where you couldn't have a casual conversation. So you can try a song test. If you're exercising and you can easily sing a song, you're probably not at moderate intensity or high intensity. If you'd be a little broken up, a little short of breath in your sentences, then you're probably at least at moderate intensity.
Great, thank you. We'll just do a couple more questions here. I think, and Linda and Ashley, you can both answer this. So do your groups, your art therapy group, your music therapy group, do they have a support group component to it, or are people expected to share, or just kind of share whatever they feel? Linda, I'll start with you.
And before I start that question, I also wanted to emphasize what Ashley said, is that if you're interested in music therapy, many hospitals and movement disorders program offer the programs for free. So you don't need to pay for them. And I would definitely check that out, and their exercise, all of their programs. We do have a component. It's not required to share if you don't want to. I know for us over the years, we've had a kind of a core group who's been in the program, and people have come in and been welcome. But I think as we get to know each other, it becomes a place where people feel safe sharing, and also sharing communication about what they've learned if they're having issues, and getting information from other people on maybe having some resolution or solutions to helping them out. Yeah, so we really just try to create a very safe place for people to come.
Thank you. Ashley?
I honestly believe that any creative arts therapy group that's done is inherently a support group. Any group of people will come together and support one another. And one thing that I really love about art therapy groups in particular is that if we give a directive to a group, people are working in their own space, even if they're not talking. When people, are ready to share and they start to show their artwork to the group, you can actually visually see a lot of similarities in the artwork, not only in the themes of what's been created, but even in terms of things like line quality, especially working with people with neurological conditions. And that can honestly generate, the bulk of the conversation and get people more willing and able to share and to articulate their thoughts. And for many of these people, it might be the first time that they are able to, because the art provides such a powerful vehicle for self-expression. It can help people, recognize things about themselves and their situation that they weren't able to see before.
No, that's a great point. And I believe that when people are hesitant to join a support group, like a traditional support group, I think these are great alternatives. And also just as an add-on anyway, I believe people should do this anyway, a creative therapy. But I think it's a great way, maybe even as an entry as a support group, because some people are just so hesitant. So I love that idea of what you said, Ashley. It is supportive in nature, right? So technically it's a support group. Maybe it's not traditional as what people would think, but it is an environment where people do feel safe and really create camaraderie. So
one other thing that I wanted to mention is one of my concerns with transitioning to virtual services was that my fear was that people were not going to be able to come together as easily, being in different spaces. But the online groups that I've done over Zoom have been shockingly intimate. The camaraderie is the same regardless of how the group is done. So I definitely would not discourage by any means starting art therapy groups over a virtual format.
Great, thank you. Completely agree with you. Dr. Bega, this is going to be our last question. Is aerobic exercise the best way to increase your lung capacity, and how important is deep breathing?
Not something that I have a lot of expertise on in terms of pulmonary issues. Also not something that is a common problem specifically to Parkinson's in terms of lung issues. Certainly deep breathing is, I think the best advantage to deep breathing is more the meditative component to it, sort of the mind-body relaxing component, which is why a lot of activities like yoga and Tai Chi and others will focus on deep breathing. I think certainly regular aerobic activity we know has a heart-lung benefit to it. I can't say if that's the best way or what the best way is to expand your lung function, but I can also tell you that Parkinson's disease doesn't naturally reduce your pulmonary function very much more than simply aging does. So there's not a big difference there between just the general population.
Okay, great. Thank you so much. Well, that does conclude our Q&A segment. I want to thank all of our attendees for submitting really great questions. And again, I want to thank Dr. Bega, Ashley Hildebrandt, and Linda Jedrzejek. I believe that what you guys do for the community is so important, and we are so appreciative of your time and your expertise today. So big thank you. And that concludes our program. Again, thank you everyone for joining us and for spending your Saturday with us. We love connecting with you, and we cannot wait until we can do it in person again. So until then, everyone stay safe and healthy and have a wonderful holiday. Thank you, everyone.